today marks the 1-year anniversary of the first COVID vaccine shot being given, but now experts are warning us of a potential explosion of the Omicron variant. We have Dr. Kohli here to weigh in on that and much more. Thank you for joining us. You look beautiful, by the way, today.
Oh, thank you.
So with the potential...
I think I look good.
You always look good.
Thank you. You didn't say it.
You always got to make it about you, Albert.
Okay.
Okay. Sorry, Dr. Kohli.
So we have our holiday colors here.
That's right, we do.
You do look very festive.
Yeah.
Okay, back to Dr. Kohli. With the potential of a lot of COVID cases, like a lot of people are calling it a quote-unquote explosion, what do you consider to be fully vaccinated?
My opinion, guys, is that you have to have your 2 messenger RNA doses and the booster, because those first 2 doses are just not enough. Now, if you got the Johnson & Johnson, then you need that plus a booster as well. But the CDC is really hedging on this, and I'm not sure I understand why, because I think as the virus is evolving, our definition of fully vaccinated has to evolve.
That's a good point. Yeah, I mean, and I do like that we have a doctor here kind of also questioning science and showing people that we don't know all the answers. This is an evolving process. So speaking of evolving process, I never clicked on the articles that would come up that would say there's a COVID pill coming, because I really thought it was clickbait. I didn't think it was real, but it's on our prompter now, so it's pretty real. What should people know about it? Like, is this like going to help people going forward?
It's going to help so much. It is such an important tool. Prevention is the vaccines, right? But if you do all your best to prevent, you get boosted and you still get infected. Before, we had nothing. We would just wait for the illness to play itself out. Now we have a pill that, taken within 3 days of symptom onset, has an 89% less likelihood of ending you up in the hospital or dying. So this is huge. But you have to get diagnosed early, right? So when you feel those symptoms, rely on that testing to make sure you get diagnosed early, get started on this medication.
Can you believe
early.
it's been a year since the first COVID shot?
I was thinking that might be in like history books.
It should be. It's so life-saving, you know?
I mean, science has been so incredible over the last year. And I look back on last year and now, and people get upset because they say we're still wearing masks and we're still socially distancing. But guys, holidays last year, remember? We had nothing.
That was my point. And everybody's doom and gloom. I'm like, I hugged my mama. Like twice this year. Like I don't know what, thank you, scientists. Are you guys kidding me?
Well,
I saw
look at
my
the lives
auntie
that are being saved. I mean, our Eric, who passed away a few weeks ago, wasn't lucky enough to get the vaccine. So it's been a year, and all this is happening in my mind in real time. Wow, it's been a year. Eric was a healthcare worker. He got sick January 15th. He was intubated, which means he was just a few days away probably from receiving that life-saving vaccine. So I just want people to really appreciate that here in this country, we have the privilege of receiving a vaccine because it is life-saving. And I know a lot of people aren't so lucky, including my brother-in-law.
I appreciate you saying that, Sam, because I always think about that when it comes to my aunt, too. Like, she was so close.
She was so close.
That's, you know, we have these conversations, and it's like, it's not about politics. It's about who's not here. And that's a real conversation. So I want to bring some levity.
Yes, please.
And thank you for getting us up to speed on COVID. So important. Sorry, I have to make this transition. So as Sex and the City fans, there's a really big debate happening about if Carrie would have just called 911 the moment that she realized that Big was experiencing cardiac arrest, that she could have saved his life. Now, one cardiologist is saying that she could have called 911 and it wouldn't have helped. So what's your medical opinion about this?
So I'm a Sex and the City fan too. And I was sad that Mr. Big is gone. But in a way, because he's a fictional character, I'm really happy that they did this, because it highlights a lot of really important teaching points about heart disease. So the first one, guys, heart disease is the #1 killer. Even last year, with all the COVID that we had.
Men and women?
Men and women. Yes, year after year after year. And the way that Mr. Big died is the way that a lot of people die from heart disease, is with a cardiac arrest. So remember that, because he's he was almost part of our families, right? Because we've known him for so long, and we lost him to heart disease. Number 2, Erica, to your point, yes, time is heart muscle. And out-of-hospital cardiac arrests have a very poor prognosis in general. But if you can get that heart started again with a defibrillator, if you can do CPR, you can save somebody's life. In fact, that's the great thing about the heart. It's so resilient. It really does bounce back. And the third thing I think to take away from this is that exercise does not cause heart attacks. And I'm a little disappointed that they presented it with him on the Peloton. But I do think you should keep in mind that exercise actually in the long term protects your heart. Now, before you start exercise, of course, talk to your doctor, make sure it's safe for you. But I think that this episode illustrated so many important things about heart disease.
It's good to know. Yeah. Coming from a cardiologist. Thank you, doctor. If you guys have a question you want answered by Dr. Kohli, please write us on social media, and you can also email info@dailyblastlive.com.